7 exercises for sciatica with Dr. Noah Volz. Sciatica is basically compression on the sciatic nerve that comes from the low back and the sacrum and goes down the back of the leg. There's multiple places where it can be entrapped, but it generally creates pain, usually pain in the butt or pain in the leg. Sometimes it can create some muscular weakness, even some tingling or burning sensations in the leg. And at its worst, it can affect the reflexes of the leg. So it's important to remember that pain itself is not only a physical phenomenon. So even though there may be some compression of the sciatic nerve creating these sciatica symptoms, those symptoms will often vary depending on the social situations, the mental state that the person is feeling. So we have to remember that even though you have a diagnosis, you are not your diagnosis. In addition to this, there are plenty of people that on imaging findings on their x-rays or MRIs look like they should have some compression in the sciatic nerve, but they have no pain. Pretty much everybody over the age of 40 has some amount of degeneration in their spine, but at least half of those people don't have any pain at all. So please know that even though you may have some abnormalities on imaging, this does not mean that you have to live a life of pain. So the 3 components of sciatic back, the sciatic nerve and the surrounding muscles. So the sciatic nerve is a combination of multiple muscles, L4, L5, S1, S2, S3, nerves that come out of these spinal segments and then band together to create the sciatic nerve. So the low back is often affected when there's sciatic nerve pain. The nerve itself, which goes all the way down to the bottom of the foot, and the surrounding musculature, those muscles are innervated by all of those nerves, and so they could be affected as well. So there's 3 orthopedic tests that can be helpful in diagnosing sciatica. One is the straight leg raise, the other is the slump test, and the last is the femoral nerve tension test. All of those can help to determine if sciatica is the cause. So 3 exercises for sciatica in the first stage are the Camel, the Figure 4 stretch, and the low back twist. So when doing these exercises, it's important to do them with awareness, to maintain your breath, to feel your entire body as you do them, to feel the effort, and to be mindful so that you're careful as you do them. So the first exercise is the cat-cow. You're on all fours, your spine is neutral, and then you round the spine, tucking the chin in towards the chest, and then you arch the spine, bringing the head back. And you can do sets of this, as many as feels comfortable for you. Next is the Piriformis Stretch. You're on your back, the feet are on the floor, and then you cross the right ankle over the left thigh, just above the knee, and then you bring that left knee towards the shoulder, taking hold of the back of the knee, pulsing gently here, keeping engagement through that right leg till you feel a stretch through the piriformis muscle, which is the back of the right hip. Then release and switch sides and do it all over again. So low back twist, you're on your back, bend your feet or bend your knees, place your feet on the floor. The further away the feet are from the body, the gentler this stretch is. So in this picture, the feet are pretty far from the body, and then the knees go off to the side, trying to keep the torso on the ground so you get a little twist through the back. And then you'd go to the other side. You could also bring your knees up and off, or bring your feet up and off the floor, your knees close to the body for even more of a twist. So 4 additional exercises for this phase are Pelvic Rocking, Piriformis Mobility Ball, Quadriceps Stretch, and low back extension. These are best done after you've mastered the first few exercises. So pelvic rocking, you're in a seated position, you round your back, tuck your chin in, take hold of the backs of the knees, and then you gently roll back onto your back and then roll back up into that seated position. So rocking back and forth. It's best to do this on a soft surface so you don't bruise your back. So next is the piriformis release. You're going to need some sort of ball, like a lacrosse ball or some sort of mobility ball, to do this exercise. You're in a seated position to start, and you're basically stretch is the piriformis stretch. You're crossing one ankle over the thigh, and then you're placing the mobility ball underneath the piriformis on that side. And then you can rock side to side on the mobility ball. You can rock back and forth on the mobility ball. You really want to keep moving here. Try not to hold one position for too long. Next is the standing quadriceps stretch. It's best to do this stretch against a wall for support. So you're standing, you bend one knee in, you reach down, you take hold of the top of the ankle, and you gently pull the buttocks until you feel a stretch through the front of the thigh. You'll want to do this on both sides, even if you only have the sciatic pain on one side. Next is the standing back extension. So you're in a standing position, you place your hands on your back just above your back pockets, using the hands to support the back. You allow the hips to gently shift forward as the heart shines open, and as you look back slightly, coming into a gentle stretch. This one can be challenging for the balance, so be really careful with this one. So those are the stretches for sciatic nerve pain. The number of reps and sets you will do will be very specific to you. So you want to do about 60 to 80% of your capacity, so you feel like you're working hard, but you're not overworking and making things worse. So variability can be helpful for this. You may need to do some modifications to make it easier or more difficult. So I can help you with those modifications. I've been doing this for almost 20 years, and so we can work together to figure out what exercises are going to be the best exercises for you. If you come into the clinic, I use a 3 where I reset the system, breaking the pattern of pain. We reinforce positive movement patterns and other lifestyle practices to minimize the stress on the system, and we retrain the body to increase strength and get you back to doing the things that you love. So if these are going to work, you'll feel some benefits within the first week. If you're not feeling benefits within the first week, then you're going to want to schedule with me or somebody else in order to see what's going on and really create a customized approach. So thank you so much for watching, and I hope this really helps.